So right now I have the patient positioned in a position that is going to promote movement from the anterior upper segments of the upper lobes. If you look at the chart that we provided you with. Now, a lot of these positions are a little bit counterintuitive, and they don't have to be perfect. We want to get them as close as we can to what the chart recommends so we can promote movement from those areas. As we mentioned earlier, any movement or change in position is going to be great if the patient can't tolerate them. So essentially, I have her lying down here, and I put two bolsters behind the patient. If you're in a hospital, that's even better. Sit them up at about a 45-degree angle, give or take, and just instruct them. I just want you to just relax, and I want you to take big deep breaths. This is a perfect opportunity to implement some of those diaphragmatic techniques as well. We've already instructed the patient that we're going to sit here for about 15-20 minutes if they can tolerate it. We're assessing the vital signs if they're near, or we're taking them. But as they're just breathing, we can instruct them on just diaphragmatic breathing as well, right? So I'm going to place my hand here on your belly and just breathe into my hand as you relax. A lot of these positions, all of these positions, excuse me, whether you modify them or not, we can actually perform more manual techniques that we'll cover next, such as percussion, vibration, and shaking to further assist mobility, the mobilization of those secretions that are in the patient's lungs. Now, let's say that I've already finished this segment with the patient, and it's I'm unsatisfied with the results, or I'm satisfied with the position itself.
And you've auscultated and ensured that we got secretion clearance.
We're going to, then we start switching if necessary, right? Now we're just going to show you different positions so that you can understand how we can position your patient, but they don't all go hand in hand. We might want to just do one during the treatment session, and that's all they can tolerate.
So now we're going to kind of set up our area for draining both posterior segments of both lower lobes. You see here that Eder is placing the bolster in a way that will get the patient up at that about 45-degree angle, about 18 inches off the table. So if we look over here, we see on our posterior segments in the middle of the last row. And so we're setting the table up for this. We will have already taken our vital signs and auscultated. And we also can use, if we don't have a nice wedge like this, we can also use pillows to do it. Or if we're in a hospital bed, we can put the patient in Trendelenburg. One of the things you need to think about when you're doing this is if he's going to be showing some manual techniques. When you do some manual techniques, you want to make sure you direct your force in the location that you're draining. So I'm going to let Eder instruct me in what position to get into.
All right, so what I'm going to have you do is I'm actually going to have you lie down with your head at the head of the bed. And this is going to go right underneath your hips if we can tolerate it. Essentially what I want to do is I want to elevate your legs, okay? If you need help getting into that position, let me know. Perfect. You need a pillow? Mm-hmm. Okay. So she's comfortable in this position, and as you can see here, we're going to be doing these posterior segments. Imagine how the secretions are going to move from these posterior segments down through the anatomy, and essentially, hopefully, all the way down through her trachea so she can actually cough them up. This is just a different position. Now, we can try, if we want to do the right middle lobe, for example. If you were to switch for me, can you lay supine with your head up here? Let's get this underneath your hips. Most of the times, we are positioning our patients, but sometimes they'll be able to do it themselves. Now, this is this is a great position, I should say, for draining that right middle lobe. Don't get confused because she's laying on her left side. We're trying to emphasize drainage of the right middle lobe, once again through the anatomy, right? And all the way down here, all the way through.
And we want to make sure that the patient kind of has a quarter turn towards their back side because the middle lobe is located anteriorly. Now, if Eder were wanting to do some manual techniques to this lobe while it's in this position, he would direct his force in this anterior way between ribs and 4 and 6. And what he would be doing is he would be providing me some instruction with breathing. So I'm going to let him demonstrate that for you. Yeah.
When we perform percussion, never, ever, ever, ever use your bare hands on a patient's bare skin. We always want to make sure that we cover the patient's skin, take wedding bands off if they're metal, because we're literally going to be drumming or percussing on the patient. But but we want to make sure that we cover. So essentially, I'm going to place a towel underneath her right middle lobe, and I'm going to bring her arm upwards so that it's out of the way. Consider that she has no deficiencies or impairments. Most patients might not be able to tolerate this, so we modify. Also, position the patient for yourself so that your body mechanics are appropriate and you're not hurting yourself. Raise the bed, move them closer to you. For example, I'm going to ask her to move closer towards me. Right, perfect. That way I'm not reaching over. The correct way to perform percussion, we're going to gently cup our hands, so thumb with our fingers. It's not a forceful cupping, and the motion is going to come from your wrist. We don't want to slap like that, okay? And we always want to start easy and then work our way up and assess how the patient's doing. We're going to do your targeted segment for about 3 to 5 minutes if they can tolerate it, and then move on to the next segment. Always auscultating in between, having them cough up if they're coughing anything, analyzing the sputum color if we need to. All these things are occurring, but let's concentrate on just the percussion. This is what it looks like, and I'm going to make sure that I assess with her if I'm hurting her or if it feels okay. I'm right in the targeted area. I'm going to cup my hands.
And the other thing is, if the patient has a lot of breast tissue, you might have them fold their hand over their breast tissue so that they are in control of it. And also, too, you never want to percuss directly over anybody's breast tissue either.
Perfect. All right, so hands cupped, and I'm going to start nice and gently. It's going to be rhythmic. If you do it appropriately, some patients actually fall asleep. It looks and it sounds like this. How am I doing?
Good.
Is that painful? Is it hurting?
No.
Okay, I'm going to go a little bit stronger. Is that okay?
Mm-hmm.
This is going to be exhausting for some of you since you don't do this frequently. That's okay. With practice, you'll be able to do it for a longer period of time. But I want you to listen to the sound between my hands that are cupped and hands that are not. Okay, we want that nice thud. Now, after performing that segment for 3 to 5 minutes, if the patient tolerated, we can follow it up with either vibrations and or shaking. At this point, I'm going to perform what's called a vibration. Vibrations are very, very small movements, almost like an isometric contraction on your behalf. Hands are flat, they're no longer cupped over this specific segment, and they're going to be performed 3 to 5 times after the postural drainage during expiration. So I'm going to instruct the patient, just breathe normally. And here in just a second, when you breathe out, I'm going to place a little bit of pressure and kind of shake through your ribs, okay? You just breathe normally. Good. Now, next breath, I want you to take a really big deep breath in and then let the air out. Good. And I'm just vibrating, almost like an isometric contraction. Breathe in and out. Good. Not a ton of movement from my hands because they're small vibrations. Breathe normally again. The third one we can do, if this does not satisfy you, is we can do a little bit of shaking. This is a little bit more aggressive, but it's also a very useful technique. Same placement, hands are flat over the segment. And I'm going to do something similar, so I want you to take a deep breath in and let it out. Good. And in and out. Good. And one more. Good. Whenever possible, when you're performing these techniques, always be in front of the patient. It isn't always possible, but if you can, so you can see, look at their face to see if you're hurting them. Sometimes they could have a trach and they can't talk to you, and you want to look to make sure that you're not hurting them via the grimacing or something of the sort.
The other thing you might want to think about when you're doing these techniques is to make sure that they're coughing. So you might, at the end of your technique, you might want to encourage them to cough out. especially when you're doing vibration. So you're trying to help with that chest deflation. You're trying to help shake the secretions out of the airway. And so at the end, you can say, when we get to the end of this, I want you to try to do a huff cough. And that can help you to be able to clear secretions. The other thing with postural drainage, if they feel the urge to cough, they should cough. That you want to encourage them to cough, because if they are coughing, you are succeeding in your treatment. The other thing I like to do when I'm doing these techniques on a patient is just to have that pulse ox on them during the treatment. So I can either have a portable pulse ox, or I can have the monitor pulse ox going. And what this does, it'll tell me what their oxygen saturation is doing. If I notice a drop in oxygen saturation, that's also a cue for me to let the patient know that they need to cough to clear secretions, because they could have some plugging in their airway that's starting to move, and it could block a segment of the lung. So we can encourage them to take a deep breath and cough to try to clear some secretions. And also too, we can encourage and facilitate some inspiration if we need to help facilitate a stronger cough during these techniques.